I want to thank you so much for joining me for today's webinar. I am Tina Norris. I'm the Family Engagement Specialist here at PTSI, and I am thrilled to have you join me here today. PTSI is a statewide nonprofit whose passion is to empower families as they are navigating special education and the disability service systems. I am thrilled to have you join me today for an amazing webinar on navigating the complex mental health system, a brief roadmap to finding the right resource. I'm thrilled to have Heather with me today. You will see her bio. Actually, it was in the flyer. And so I want us to really have an opportunity to really delve into the content today, and at the end, we will have an opportunity to open it up for questions and Q&A. If you can utilize the chat feature for me, I will be monitoring the chat as Heather is actually presenting. And then also, if you have a question and you would like to request to be unmuted, please raise your hand and I will try to do that in that order as well. I wanted to introduce Heather. She is the Community Outreach and Compliance Coordinator with EMS Ventures, a parent company of My Spectrum Counseling and Coaching and EMS of Virginia. She holds a master's in social work from the University of South Carolina and has spent most of her past 20 years working within auxiliary to mental health, substance abuse, juvenile justice systems in 4 different states. And outside of her work, she enjoys reading, true crime podcasts. I had to smile when I saw that, and spending time outside with her family. So at this time, I am going to turn it over to Heather. Thank you so much again for joining us.
Thank you, Tina. Thank you so much. It's great to be here. And thank you to everyone who's joining us today. As she said, I am the Community Outreach and Compliance Coordinator for EMS Ventures, which is the parent company of My Spectrum Counseling and Coaching and EMS of Virginia. We are mental health agencies. I work for the parent company of the two. We're located in North Chesterfield, but we serve all of the state of Virginia. So a lot of this, and I realize that many of you are going to be throughout the state because of PTSI. So a lot of this is not specific to any particular locality or area of Virginia. But in talking to Tina about how we may be able to work together, she had mentioned that it would just be really helpful to share kind of the complexities of the mental health system, which is actually pretty difficult to navigate even as a professional at times. So without further ado, friends, I do have, I like to do some engaging kinds of things and stuff. So I've sprinkled a few little surprises throughout the presentation. I may use some self-deprecating humor at times, but in all honesty, mental health is very much a passion of mine. And I really do work very hard to find our clients and friends and moms and other referral sources, the right resources, because it is not always easy or intuitive. So let's start with kind of the idea of what exactly is the mental health system. So it's comprised of different levels. It's comprised of different programming. It's comprised of different funding sources. And so I'm a big visual person. So I made this fun little chart. So there's outpatient providers, which are going to catch most of the clients who would be entering the mental health system. And then there are also some peer-led initiatives. We're not going to spend a lot of time today talking about what those are. That is more going to be kind of like support groups, things like walks and supportive initiatives, things that students, student-led type things for schools, for colleges, and even some employee-led type things for within the workplace. The next sort of higher level, kind of going from like who touches the most people, outpatient, probably then peer-led initiatives. Then after that, it would most likely be community providers. And we're going to be going into a little bit more detail along the way on each of these, what each of these comprise. Community providers provide an array of mental health services. And then there are hospitals, crisis and acute facilities. Again, we'll kind of touch on that. Residential facilities, which is different than in an acute facility. And then there's crisis, hot and warm lines throughout that support different ages, different needs. And I see that there are multiple hands in chat raised. Tina, can everyone hear me okay?
Yes, one of the questions that I'm monitoring the chat, can you explain what EMS is for that acronym?
Yes, so EMS stands for Educating, Mentoring, and Success. It is often confused for ambulance services, but it stands for Educating, Mentoring, and Success. We are a community-based mental health agency, and I'll explain once we get to the slide which services we actually provide. But we are a community-based agency, and then my Spectrum Counseling and Coaching is one of the outpatient providers. And we'll go to the next slide. So kind of thinking about, this wide range of services and service opportunities, how does somebody know what is needed? Okay, so it is, there's all these different kind of things in front of us, and it can be very fragmented and really difficult to understand exactly where to go if you or your child or a friend or a coworker is experiencing some mental health symptoms. So things to look for to kind of identify where might be the best option for you are going to be, what are the current symptoms? So are they new? How severe are they? Are they impacting someone's life? The typical kind of standard for mental health has it been 2 weeks or longer that these symptoms have been occurring? So is it, whether it's sadness, frustration, anger, anxiety, but what are those current symptoms? And then how much are they impacting your life, your child's life, your friend's life? And then how severe are those symptoms? So is it causing somebody to be unable to go through with their daily lives? Is it causing somebody to be unable to get up and go to school for children because they have anxiety or they're in a depressive state? If it's aggressive behaviors, for example, are they at risk for school suspensions or expulsions? Are they putting their siblings at risk because of the behaviors? So the first thing to kind of look for is, what are the current symptoms that they're exhibiting? How severe are they, and how much are they impacting your life, their life? Is it the first time that the symptoms have occurred? Is this brand new behavior? Has it ever happened before? Is it just starting for the very first time? And if not, how often or how frequent does it happen? So like I said, in the mental health world, we kind of look at, it hasn't been happening for 2 weeks or longer. And some of the screenings that we'll talk about in a few minutes are asked those questions. Over the past 2 weeks, how often has it happened? How many days have you felt like that? So if it's not the first time that the symptoms have happened, and again, it could be sadness, it could be anger, it could be frustration, it could be anxiety, it could be aggression, it could be a combination of any of those things, hyperactivity. So if it's not the first time, how often or how frequent have those symptoms occurred? And then the final thing to really think about when thinking of the different levels, the different options, whether it's, the next slide, we'll talk about low, medium, high, is what's the current danger level with the symptoms or behaviors. Now, danger isn't necessarily a clinical term. It's it is very subjective, but are they a danger to themselves or others? And if that answer is yes, then it's definitely going to be on the higher end of the spectrum of what mental health resources that you're going to want to look for. So now we have, again, I'm a big fan of visual aids, although some of my slides ahead will have more words on them. But So the highest danger, okay, so I'm trying to kind of just, again, these aren't really clinical terms, but if a person is presenting dangers to themselves or others, or they have things like, self-harming, if they have suicidal ideations, if they're thinking about hurting other people, or if they are just unable to, get out of bed, take care of themselves, if their grooming and hygiene habits have gone down. So this is where it would be kind of high level, kind of a danger situation. So that would be the acute care or hospitalization, a residential facility. Typically, a residential facility would not be a first stop. Usually there would be symptoms before then, and often it's a stop after a crisis stabilization or hospitalization. And then crisis stabilization or intervention, those are short-term, very intense, but very short-term kinds of things for people who are exhibiting those high-level needs or kind of more dangerous symptoms, not just to themselves, but maybe to others. And then there's sort of this mid-level concern where it's urgent, but maybe not emergency. And so those include partial hospitalization programs, intensive outpatient programs, community or in-home mental health or behavioral services, and then rapid access programs. And I'm going to kind of delve into these a little bit each in the next slides throughout the presentation. I hope to stop with plenty of time to answer any questions that you might have. The final kind of low, like people are mostly stable, but they're having difficulty managing their behaviors or their symptoms. They want help, right? They understand that maybe they're not able to do it on their own, but they're mostly stable. They're not really presenting a risk to themselves or anybody else. It's not necessarily completely affecting their daily life as far as they are able to get to work, they're able to get to school, but they just need help kind of working through those concerns or those symptoms. Then that would be more for the traditional outpatient therapy, support groups or therapeutic groups, and then most of the peer-led initiatives. I left off the crisis and warm lines, those hotlines and warm lines, because those actually interface with all of the different levels. They could be a resource finder, they could be somebody who is actively thinking of suicide. So they interface with people at any of these levels. It's not particular to one specific level of kind of care or level of symptomology. So we'll start. We started at the high last time. We're actually going to start at the low and kind of build up for levels of care. So outpatient would be the first. There are public and private practices and providers throughout the state. It's that one-to-one kind of therapy. It can be individual, couples, family therapy. It's typically offered in person within offices or virtually through telehealth. It's usually on a set schedule. Usually it's not more than 3 hours in any given week. This is just kind of what insurance companies and what insurance companies and people would define as outpatient is typically less than 3 hours per week for the traditional one-to-one type therapy. It's usually provided by people who have specific credentials and licenses, often LCSWs, licensed clinical social workers, licensed professional counselors. Some psychologists do outpatient therapy. And some practices also offer therapeutic groups that may be specific to different ages, genders, diagnoses, therapeutic modalities or conditions. So there's grief groups, there's couples groups, there's divorce groups, there's parenting groups, there's, specific modalities, DBT, which stands for dialectical behavior therapy, that is intended to be done in a group setting with a lot of people. That's very much a skills-based type therapy. Anxiety specific groups, there's teen girl support groups, there's teen boy groups. So that's also typically offered at the outpatient level. So public providers in each locality or area here in Virginia are called community service boards. Locally, they may go by a different name. So here in Chesterfield County, where we're located, our community service board actually goes by Chesterfield Mental Health. It is the community service board, but on the building, it says Chesterfield Mental Health. RBHA, Richmond Behavioral Health Authority, is the community service board, but it goes by Richmond Behavioral Health Authority. So there is a listing of all the CSBs in Virginia on this link. Everyone will get a copy of these slides. And so do not worry about trying to kind of, find that information independently. You'll get a copy of these slides after the presentation. So, but I included the listing of all the CSBs because they typically accept commercial insurances as well as Medicaid and Medicare. And they also typically offer reduced cost treatment for underinsured or uninsured clients. They, since they are publicly funded, they often have some grant funding and specific funding set aside for people who may not have behavioral health coverage or insurance, but may need that support. We'll talk about CSBs, their rapid access programs, each one has in a few slides, but they offer things like psychologists. Typically, they can do evaluations. Usually there's a little bit of a wait on evaluations, which we'll talk about again in just a few minutes. That one-to-one kind of therapy, couples therapy, family therapy, they typically offer that. And they'll see children and adults at all of the CSBs. Private providers are often they're scattered throughout the state. It's easiest to find them through places like Psychology Today or through web searches. You can also consult your insurance, as providers would need to be in network with the insurance to accept that. Payment methods do vary by private practice. They often include a blend of insurances and self-pay. Some take Medicaid or Medicare. The best thing, if you're looking for that private provider that may be close to you, the best thing would be to consult with your insurance to make sure they do take it. Although each practice I'm sorry, my cat just jumped up. Each practice will verify your insurance ahead of providing you any services. Therapeutic groups will vary by location and outpatient practice. They're usually time limited, so they may be 6 to 8 weeks. They can also be found on things like Psychology Today, web searches, and then often on the practice websites or their social media. Therapeutic groups are often not covered by insurance. They are often private pay, and it may be per group, or it may be a set amount of funding for that group. Like it's, for example, often if there's 8 sessions of a group that's held weekly, it may be $200 or $300 for the cost of those 8 sessions. Some insurances do cover group therapy in small portions or put it towards the deductible. And then there are some practices that do offer complimentary or free groups or have some grant funding or supplemental funding to support people who may not be able to afford those therapeutic groups. But a therapeutic group is going to be that thing that's kind of focused around age, gender, modality or theme or the diagnosis. And it's usually anywhere between 5 to 15. We in the social work world, we kind of think that 8 to 10 is typically a good group, depending on what the theme is. It could usually anywhere between 5 to 15 people could be found in therapeutic groups. So in thinking of where mental health definitely intersects with special education, it's going to be in these outpatient evaluation options. So there are lots of different ways to get children evaluated and adults. So ADHD actually has its own evaluation. ADHD, for those who may not know, is attention deficit and hyperactivity disorder. It has its own separate evaluation that was created so that pediatricians, nurse practitioners, therapists could do it outside of psychological practices and psychological offices. Most insurances will cover that evaluation, but they often will need a referral from a pediatrician or provider first. It can also be offered by psychologists and psychiatrists. Excuse me for just a moment. And the ADHD evaluation typically is a blend of parent and child interviews and observation, and then often a survey or interview to the child's teachers or child care providers that work with that child. The next type of evaluation that can be done outside of a psychologist office is also an autism evaluation. There is special training for therapists or behaviorists that can do a standardized autism evaluation. There's several different instruments out there for autism evaluations. It's often still done by psychologists. There are providers that only do autism evaluations, but they're standardized instruments that measure developmental history, again, child-parent observation. And then for older children, it usually includes like an intellectual scale and then some measures of understanding and executive function. The final kind of popular evaluation, I guess I don't know if maybe that's the best word, but final evaluation, a lot of interfacing with special education services would be the full neuropsychological, which is usually only completed by a psychologist or maybe a PhD student. And those measure specific cognitive abilities, strengths, weaknesses. It usually results in an IQ score and an intellect measure, executive functioning, visual and spatial relationships, language acquisition, how easily kids acquire and speak and understand written and spoken language. And those neuropsychologicals are using standardized instruments, observation, also parent surveys, and those are also often required or helpful to have in getting accessing special education services, but also in accessing Medicaid specific special needs and developmental services. Most insurances will cover the autism evaluation with a referral from a pediatrician or provider. And then many of them, I won't say most, will cover the neuropsychological, and usually a referral is required. The tricky thing with neuropsychologicals is sometimes, at least in our experience, in my own home, it was applied to the deductible. The evaluation was applied to the deductible. It was not, it was a covered service, but it was applied to the deductible. So we actually had to pay out of pocket for that. And so I would just warn those who have commercial insurances to make sure to talk to the providers in advance. And there are some psychologists that do not accept insurances at all in Virginia. There's areas of Virginia, especially where it's more likely to find somebody who does not take insurance than it is to find somebody who does. So moving into more mental health specific, kind of like what we traditionally think of mental health. Depression, there are also depression screenings. There's several standardized measures to screen for depression. This is that thing that I said, usually we kind of look at the last 2 weeks. So usually in an intake into any mental health provider, often the therapist or doctor, or even in my case, my PCP does the depression screening during my annual exam, my annual checkup. And my son's pediatrician actually just did a depression screening and an anxiety screening on him at his 13-year-old checkup a few months ago. So depression screenings have become a lot more accepted and standardized into health practice as we blend mental health and physical health together. And really, I think there's a lot more acceptance that they are both related, right? Mental health is physical health. So there's several standardized depression screenings that are used. They can be used for kids as young as typically 5 or 6. And it's often done as part of the intake. Insurance does usually cover those types of screenings. And it's just typically part as an initial intake. As long as there's behavioral health coverage, for example, then typically it's covered. Anxiety screenings are often used again by primary care providers, pediatricians now. Several schools have started adding in depression and anxiety screenings. These are standardized instruments again that are scored. And again, the questions are related to within the past 2 weeks. They are also worded for younger kids if used in younger kids. So it's used in ways like, have you felt scared, instead of, has it felt like your heart has been racing faster than usual? So when used with younger children or early adolescents, it is typically used in words that they would understand and not in mental health jargon. They're also usually offered as part of the initial appointment and included in the intake. If the intake is covered by insurance, then it would also be included. Finally, suicide assessments and screening. We are not going to be spending a lot of time today talking about suicide assessments or screenings after the slide. But many school staff, in addition to healthcare providers, mental health professionals, new intakes for almost any service that is offered in the mental health field, we've all started incorporating a standardized suicide assessment. The Columbia Suicide Screening Index it's free, it's accessible, it's online. They even have a 5-question part that they're encouraging any doctors, even teens and school counselors to use with kids, just to kind of gauge the risk level. So they're typically included as part of intakes, but they're often provided at no cost. And like I said, there's a lot of school systems, and school counselors, after school programs. There's a lot, and even churches. There's some churches that have started incorporating this into their youth groups, and just to kind of gauge the risk, the level. All right, so now moving away from psychologists and testing and screening. Now we go into, this is all still part of our outpatient realm though, which is why I said that the largest catchment area of people who interface with the mental health system are going to be in that outpatient realm, because it includes all of these different types of providers. So we're going to finish with medication providers. So to prescribe mental health medications, specifically things like antidepressants, anti-anxiety medications, a lot of mood stabilizers, especially. Typically, they're most likely going to be prescribed by psychiatrists or psychiatric nurse practitioners for long term. A lot of primary care providers, and even for women, OBGYNs, can prescribe short-term antidepressants, anti-anxiety type medications, but for long-term sustainability, for people that may need it for years, for their lifetime, then they are often referred out for long-term support for psychiatrists and psychiatric nurse practitioners, which is what the NP is. I just couldn't fit it on the title slide. So psychiatric medications include a whole host of anything that basically reduces symptomology or affects behavior or thinking. Okay, so cognitive thinking. Those are all parts of what go into mental health diagnoses. So antidepressants are going to help affect the neurotransmitters and hormones that affect depression and reverse the symptomology for depression, hopefully. Mood stabilizers are going to help people who are maybe experiencing typically more of the ups and downs, kind of just feel a little bit more even. Antipsychotics are the ones that may affect a little bit more of the cognitive thinking, because a lot of people who are experiencing or showing symptoms of psychosis, and I'm not going to go into a lot about what these different diagnoses are, but they often will show very drastic changes in thinking and thought and inability to tell reality from dreams or not reality. So antipsychotics will often not just affect moods and neurotransmitters and that, but also kind of just affect the thought process. Anxiety medications are going to affect those neurotransmitters that are maybe a little bit overactive to get people kind of having that fearful response, the anxiety response, heart racing, those types of things. So they bring down the response, the psychosomatic response. And then ADHDs are often, or ADHD medications are often stimulants. Those are the ones, the traditional kind of Adderall, Vyvanse, Concerta, they're all stimulant medications, and stimulant means that it can increase heart rate, blood flow, those types of things. But because they are stimulants, they often long-term need to be managed and are usually managed by a psychiatrist or nurse practitioner. Psychiatric appointments are typically covered by commercial insurances, Medicaid, Medicare, any type of insurance. The waits can sometimes be long, especially for younger children, like that 5 to 10-year-old age range. Medications, though, may not be fully covered by insurances. And psychiatrists may not always know whether there's like what is covered, because different prescription plans cover different things. So generics, if there's a generic for the medication, it is typically covered by insurance, but the name brand may or may not be. And these providers will evaluate clients for the mental health diagnoses at the intake. If there's little to no history, if they already come in with hospital records or outpatient records from another provider that they've been struggling with these things, they'll do an evaluation, but it may not be as deep as an initial evaluation for clients who have no history. So sometimes people have their very first interaction with the mental health system through a psychiatrist because they are looking to find a medication to make their symptoms stabilize. Typically, psychiatrists or psychiatric nurse practitioners see their clients at least once every 90 days. That's often required by insurance. It is often monthly if they're on certain medications. And they may try, the big thing is they may have to try different dosages or combinations of medications to help clients with their symptom management, because one size does not fit all friends with medications. And even things that have done very well with 75% of other clients, there's still that 20%, 25% that it just does not touch their symptoms. So it can sometimes take 6 months from the start to really learn what dosages and combinations of psychiatric meds may work for adults, children, or anyone who is on them. All right, so we're moving out now. Remember the little thing I made? We're moving out from the low level and we're moving into the medium or urgent level. So rapid access is a state mandated program that every community service board, which are the public outpatient providers in each locality, that they have to have a rapid access program. So it's designed to increase the availability of psychiatric services, substance abuse services, therapy, crisis. Many offers same-day availability. All of the rapid access programs are expected to have availability within 5 days of contact. I apologize, I'm putting my cat down right now. So again, earlier in the slide deck, all of the CSBs are listed. You will get a copy of these. To find the rapid access phone numbers, it's usually on the CSB websites or by calling the CSB and requesting rapid access. Today, we're not really talking a lot about substance abuse services. Specifically, really, we're not talking about it at all. But the rapid access also offers things like medically assisted treatment for people who may be detoxing or going through withdrawals as well, and can offer next day availability for people who are experiencing some psychiatric symptoms that are concerning, but may not be at the level where they need a hospitalization or an actual crisis intervention team to come out. And so it's a really good option for people who need to get services very quickly. They do triage clients, just as an FYI. So when people call in, they do have some appointments specifically set aside for those that would be most urgent, people who may be going through withdrawal, people who may have just discharged from a hospitalization or crisis type intervention and not have any psychiatric medications, people who may be experiencing those high level symptoms, suicidal, homicidal thoughts, psychotic type symptoms, who have already been hospitalized, that need that continued medication. So they do triage kind of in what they would consider the level of most urgent to least urgent, but they are expected to have availability within 5 days of contact by the state. And that was Veruca Salt. So we're still in this mid-level. So community-based services. This is what my agency, EMS of Virginia, provides, the education, mentoring, and success. So we offer some of these Medicaid services that are listed. So there are different levels of community-based services based on what the funding source is. So I've separated these out by funding source. The Medicaid on the left side of your screen is the largest funder of community-based services in the state. And so mental health skill building is an adult service. I'm not going to go into a lot of detail about exactly what the services are, but feel free to ask any questions and I'll take them at the end. So we offer specifically the mental health skill building, some of the comprehensive crisis services and intensive in-home services, and therapeutic day treatment, and then MST and FFT. I could not fit it on the slide, but it's multi-systemic therapy and functional family therapy. So those are all funded by Medicaid. They are all done within the home and community. So the staff will come out and work with clients directly within their home and community. They're all higher level than outpatient. Like it's going to be a minimum of 3, 5, typically often 6 to 10 or even 12 hours per week for a lot of those services. And that is usually going to be a step up from outpatient for clients who may be an outpatient and the symptoms are not improving. Therapeutic day treatment is actually often done in schools for children who have some behaviors both in the home environment and the school environment. A lot of the services do require what would be considered acute symptomology or urgent needs, kind of those urgent needs. For mental health skill building specifically, it's adults. That's the only service that's listed that's exclusively adults. And it does require a prior hospitalization or interfacing with the crisis system at some point in the past, some sort of crisis intervention. Moving to the next column is CSA. That stands for Children's Services Act. I have a whole slide dedicated to that in just a moment. And CSA services are locality based. I'll talk about that more in the slide. So CSA services is a different funder source. It is it's a state and local funding. They share the burden for those services. And they provide services to kids and families who cannot otherwise access that system. Because if we go into the final column of commercial insurances, some do offer in-home support, in-home behavior support services, mental health support services. Some commercial Anthem plans cover it. Some of the Optum plans cover it. But many commercial insurances do not cover in-home behavioral health services for youth or families. And often they must use a very specific provider. And then IOP and PHP, again, I have a whole slide dedicated to those. I'm just doing a quick time check. All right. IOP and PHP we'll talk about in a minute. IOP stands for Intensive Outpatient Program. PHP stands for Partial Hospitalization Program. Commercial insurances do typically cover those. All right. Remember I said I had a whole slide on CSA services. That's where we're at. Children's Services Act funding. So the Children's Services Act was passed, I think, in 1993. I did not actually put that on the slide, and that I think it's 1993. So that and the state of Virginia wanted to give each area and each locality its own pot of funds that to allow access to services for kids with severe behaviors. Basically, is kind of like the nuts and bolts of it. It is the local area, so the locality puts forth money, and then the state of Virginia gives, I think it's 2/3 from the state, 1/3 from the locality or the local area. And it is funds for children and families that are unable to access the service otherwise. So if children have Medicaid and Medicaid offers that service, they cannot use Children's Service Act or CSA funding. But if a family has commercial insurances and would really benefit from that in-home level of support or crisis support in the home that commercial insurance may not cover, then that's where CSA funds come in. I have let's see, I'll move the little. So right there on that link, again, everyone will get the slides. I have put the list, that is the index to find any local CSA contacts if you feel that this may benefit your family. There is an application process. So you would need to go through your local Children's Services Act or CSA provider, start with the CSA coordinator, and then usually there's an application, and it may involve a petition to the local court to basically petition those funds. Each locality has a slightly different setup and a slightly different way that they go through with filing and acquiring and accessing CSA funds. It's child and family focused though. The families are going to then be part, if they're accepted, their application is submitted, they're accepted. The next step is they're going to meet with a family assessment and planning team, usually, which is abbreviated FAPT right there. That team will help design the plan for the youth and family with family input. And there's usually a FAPT monthly meeting, and they will identify providers, what services may benefit, and then approve a set number of services, hours, those types of things for a set amount of time. The children must be exhibiting severe behaviors. That's really they have to be at risk for out-of-home placement. FAPT or CSA services are often used for kids that need specialized schooling due to their diagnoses. And the parents may not have the means to pay for that schooling. So specific day treatment or school environments for often for mental, it's for mental health, but it can be used for some developmental disabilities or some developmental delays as well. It can be used in a blend, but it is definitely behavior based. So it's based around the children's behaviors that they're exhibiting and what risk level it puts them at if they continue without service. All right, so next one, IOP and PHP. So again, a couple slides ago, I said I'd go into detail about this. Partial hospitalization programs are higher than IOP programs. So partial hospitalization are abbreviated PHP, and they are typically for 2 to 3 weeks at a time. Often it's 9 to 3. So people will stay at their home at night and then usually on the weekends, and it's typically Monday through Friday, 9 to 3 for 2 to 3 weeks. These are very intense. They include group therapy, individual therapy, psychiatric assessment and medications. There's often skills groups. So this is, it's often used for people stepping down from hospitalizations or residential treatment, or for people who are in between as a buffer to prevent people from needing to go up to hospitalizations or residential treatment. Intensive outpatient programs are a little bit less intense. They're usually offered 3 to 4 times a week, and then its sessions are 2 to 4 hours at a time. So they often go though for 6 to 12 weeks. And again, that's used typically for people who are leaving hospitalizations or residential treatment facilities, or people who have tried maybe community services or outpatient and it's not working, and they step up to intensive outpatient. So I talk about them as in-between options because they're often used as step down or step up. And intensive outpatient programs are usually group-based and skills-based curricula. These are typically affiliated with hospital systems or large outpatient providers, or even residential treatment facilities, because there's very specific staffing requirements that they need per insurance. But the good news with IOP and PHP, for those of you out there who may have commercial insurance, is they are often covered by most commercial insurance plans. So, and Medicaid also covers PHP and IOP. All right, so now we're moving into that high level. I'm going to try not to, I'm actually a little bit behind on time. I talked more than I thought I would. We're moving into that high level on that first graph that I had. So we are now acute psychiatric emergencies. All right. So these are clients who are an immediate risk to themselves. They may be showing signs of suicidal thoughts or behaviors. They may already be self-harming. They may be stating very concerning very concerning things that makes a person think they are not safe to be left alone. Okay. Or clients who are an immediate risk to others. This could be threats or actions. This includes kids who may, make threats of violence towards others, including on the internet, okay, or describing how they want to hurt others, adults who may or be doing the exact same thing, or clients who are displaying a significant change in thoughts or behaviors. So this is that little bit of psychosis I mentioned. If somebody who typically is thinking, very logically, able to express themselves very clearly, and then all of a sudden they're having difficulty telling reality from what's not really there, hearing voices or seeing things that others don't hear or see, then those would be what we would consider in the mental health field acute psychiatric emergencies. They need that emergent type help. Hit the help button. The help button is going to be dial or text 988, which is the mental health emergency and suicide hotline. This is nationwide. I do believe everyone here is in Virginia. Sorry, my cat is feeling neglected. I believe everyone here is in Virginia, but 988 is nationwide. The great thing about 988 is that the way it's set up, it will actually redirect you to your closest crisis hotline area based on where you call, whether it's a landline or a cell, what cell tower you ping from. So they can find resources immediately available. They can dispatch a crisis team to you. They can also call ambulance or police. I say all of that to note that if there is a medical emergency within any of the behaviors that are being seen, such as an actual suicide attempt, severe self-harm, they're an immediate risk to others, they have a weapon, anything like that, 911 is going to need to be called, not 988. But 988 is available by phone, text, and on this link, again, you'll get the slides, web chat. So they actually do web chat on their website. Another option for those acute psychiatric emergencies would be the local hospital ER, wherever you are at. The local hospital ER they do not need to have a psychiatric component. The local ER, all ERs are tied within a mental health system. They are all linked to what is called the bed registry in Virginia. And so any ER can access the bed registry and can transfer to a psychiatric unit or to a residential facility upon entry. So just a local hospital ER. And many areas and localities now have what are called crisis stabilization units or crisis receiving centers. There are not as many for children as there are for adults, but those are also accessible through 988. And those units or crisis receiving centers also can accept referrals directly from law enforcement, EMTs, and local ERs as well. So the final sort of level is residential treatment options. This is the long term. So a hospitalization or crisis stay is going to typically be 7 days or less. There are some hospitalizations that go up to 10 days. Some youth crisis centers even go up to 15 days. So we'll say 3 weeks or longer is where we'll go into residential treatments. There are numerous specialized treatment centers throughout Virginia for youth. Some do accept commercial insurances and or Medicaid. Many of them have those CSA contracts, the Children's Services Act contracts. So for a lot of residential treatments, families do need to go through CSA or that FACT team, the Family Assessment Planning Team. A lot of them need to go through that to access residential treatment because there's limited bed space, first of all, but there are also limited payers for residential treatment. To learn who may be in network with commercial insurances, if you have commercial insurance, you would need to talk to your insurance. And if the insurance only pays for part of the bed or something like that, that's another one of those things that CSA, the Children's Services Act, can go through. Now, CSA does need to approve those funds in advance before the youth goes to residential. And each locality has a little bit different kind of set up on how those funds get approved. There is also Medicaid specific programs and Medicaid specific funding for some residential treatment options in Virginia as well. Group homes, which are typically funded also through Medicaid or the Children's Services Act, are another residential treatment option. They are typically going to be longer term. Many are indefinite for people who may have specific diagnoses. They do have adult group homes for mental health clients. Sometimes they do have minimum IQ requirements. So if it is somebody who has both mental health and developmental delays, that is something that would need to be explored in advance. The final one for children specifically is therapeutic foster care. That's also typically funded through Medicaid, CSA, the Children's Services Act, or DSS funding, and is typically a short-term focus with a goal on reuniting the family once the behaviors and family dynamics have stabilized. This last page, we don't even need to actually go over. We're going to send out the slides. Here are some resources for where to find local mental health support for you and your family. This crisis text line right here, they do chat online, or if people text home to 741-741, they'll do a text crisis. NAMI Virginia has support groups throughout the state. They have virtual support groups for those who may not be close to an in-person. They have them for families or for family members and clients and teens themselves, children. The Cameron K. Gallagher Mental Health Resource Center at Virginia Treatment Center for Children has a huge library of mental health resources. And then finally, the Mental Health America Virginia's Warm Line. Here are the hours. It's called a warm line, not a hotline, because it's not open all the time. They do offer tech support on some hours and some days. Trained mental health professionals will answer that. And then this final one is just a reminder about 988, which is the crisis and the new state and national crisis and suicide hotline. And now I'm going to turn it back over to Tina to take any questions in the chat. Here is my contact information. Again, you'll get a copy of these slides. I love cats. Obviously, I have one. Here's a picture of a cat too. But you'll get a copy of these slides. Please email me any questions that you might have. If you think of anything after the presentation. And I'm going to stop sharing, I think, Tina, and we can talk about any questions that you guys have.